Hello everyone. Today I'm going to talk about three homeopathic remedies for cough, and these three remedies have involvement of larynx. So the remedies I'm going to talk about today are Drosera, belladonna, and phosphorus. So first moving on to Drosera. In Drosera, the cough is mostly at night. As soon as the patient lies down in bed for going into sleep, the cough will start. And the character of the cough is very important. It is most usually a dry cough. There is involvement of the larynx, so the patient will feel a tickling sensation in the throat. Maybe deep down in the larynx, there'll be a tickling sensation, and the cough starts. And the cough comes in paroxysms. That is, it is a recurring cough, one cough following the other so rapidly, very rapidly. One cough followed the other very rapidly. Sometimes there is not even a gap in between the cough. So the patient will be exhausted, even will be slightly breathless because there is not even time to get breathe. So it's a night cough with continuous cough, recurring cough. After the cough, maybe a little bit of amount of mucus may be produced. Sometimes there is only retching. Retching is when the body makes every motion to vomit, but nothing comes out. Or they could even be real vomiting. Now, after this, the patient will sleep for some time, but again he is woken up at midnight with another bout of coughing. This may continue. So, remember the dry cough, the tickling in the larynx, and this continuous paroxysm, this continuous episodes of cough. Sometimes there'll be hoarseness of voice also in Drosera. Some other modality, aggravation factors for Drosera are drinking, singing, laughing, weeping, etc. all can cause cough. Next remedy, belladonna. In belladonna, it is a painful cough. There is involvement of the throat. The throat will be red and congested and very painful. There is laryngitis and the larynx will be painful. So, if it is a child, the child will start weeping even before the cough comes on because he knows it is going to be very painful. The patient will feel as a clutching or something is grasping in the throat, and it causes pain, and the cough also is painful. The cough is painful to the throat. The cough can cause pain in the chest as well. Another character is the throat and the larynx will feel dry. The mouth also feels dry in belladonna. So there is pain along with the cough in the throat and in the larynx, and there is also dryness. Now, the larynx is very sensitive in belladonna. Swallowing will cause pain in the larynx and it can also excite cough. Moving the head, slightest motion which touches the larynx will cause cough and pain. So, moving the head, maybe moving the head backwards or side to side, again can cause cough. Just like in belladonna, just like in Drosera, the cough in belladonna is also more at night than during the daytime. So more at night, and this painful cough, painful larynx, painful throat, dry mouth, dry throat, dry larynx is characteristic of belladonna. Like in Drosera, there could be hoarseness in belladonna as well. Next remedy is phosphorus. In phosphorus, there is not only involvement of the larynx, but there could be involvement of the chest as well. So there'll be tickling in the larynx and there'll be tickling in the chest. So with the cough, there'll be pain in the chest. The patient will feel burning sensation in the chest. They will want to hold on to the chest because the chest may feel congested or suffocative feeling. So that is there. Involvement of the chest is there. Involvement of the lungs is there in phosphorus. In phosphorus, the cough is at first dry, but later there can be expectoration. And the cough, talking, breathing, and any use of the voice will excite cough in phosphorus. In phosphorus, there is hoarseness of voice, and with the hoarseness, there will be pain in the larynx also. And this painful hoarseness in phosphorus is aggravated more in the evening. Another characteristic modality of phosphorus is the cough is excited in cold air. When the patient goes from warm room to cold air, it will start a cough in phosphorus patients. Now, you can also consider phosphorus in hoarseness of voice, like already told you. So, in public speakers or in singers who experience hoarseness of voice, whenever there is weather change, you can consider phosphorus as one of the remedy. The phosphorus patients can go into total aphonia as well. So in phosphorus, there is evening aggravation, there is cold air aggravation, there is involvement of the chest, there will be breathing difficulty, burning the chest, burning the throat, all will be present in phosphorus. So you can follow me on Instagram. If you like this video, give it a thumbs up and subscribe to this channel.